Well, I think the first thing that is involved with this process is to have an educated, realistic expectation of the results. And if you expect that the results are going to be 100% positive all the time, that's not realistic. And I think we're disappointed mostly when our expectations are not met. And if our expectations are not realistic, then it's easy to get disappointed. So first thing is that before we even start with a patient cycle, I think we spend a lot of time counseling them as to what their expectations ought to be. And this is continued to the time of the embryo transfer. And if, in fact, after that, the embryo transfer does not result in a pregnancy, we meet with the patient and we go over and reconstruct and critique the cycle to see what went on, what, if anything, ought to be changed. Not infrequently now, patients, perhaps from the cycle, may have cryopreserved embryos that could be utilized. We look at different aspects of the patient's physiology from the perspective of issues involving implantation that range from the patient's immune system to the type of embryos that are implanted. A very common reason why embryos don't implant may have to do with the genetic content of the embryos. It's possible that perhaps the patient should have different things evaluated prior to another attempt. But these are very individual procedures, very individual outcomes, and very individual counseling that we do on a one-on-one basis, so that everybody is different.